Hi, if you saw my last video, I talked about why it's so important to have your thyroid antibody levels tested, and even more importantly, why you need to not only have TPO, but also to have anti-thyroglobulin levels tested. I'm Dr. Hagmeyer. One of the questions I'm often asked is, why are my antibody levels still elevated? And this is a great question, and I want to unpack that in today's video for you. Many of you watching this video either have already been diagnosed with Graves' disease or Hashimoto's thyroiditis. You're taking medication that your prescribing doctor has you on. You stopped eating certain foods, yet despite all of these efforts, antibodies still remain high. Well, there's no doubt that this can not only be frustrating for you, the patient, but also for whatever doctor's treating you and working with you. So what's going on here? Why is this happening? Okay, the key word for today is triggers. Okay, this is what this all comes back and what it comes down to. So while this video is primarily directed for people that have antibodies that are elevated with autoimmune thyroid disease, the principles in terms of what we're talking about apply to everybody with an autoimmune disorder. Okay, so if you have lupus or you have celiac disease, you have Crohn's, you have diabetes, you have MS, the things I'm going to talk to you about today still apply to you. Okay, the process of getting control of your health, without a doubt, at times it seems daunting, it seems overwhelming. You may feel like you're fighting a battle and just losing at every corner. But I want you to realize there is a light at what seems to be a very, very long and dark tunnel. Okay, if you ever want to reclaim your life, the three things that I think are just absolute, these are three things that are just so important, you may want to write these down, is number one, you want to identify the autoimmune trigger. That's number one. Triggers, I should say, because there's never just one autoimmune trigger. There's usually multiple triggers. So identify the autoimmune triggers. Number two is you want to stabilize the compromised systems of the body. Number three is you want to correct the problem in the proper sequence. Okay, so number one, identifying the triggers. These are going to be the underlying root causes behind why your immune system is attacking your tissue. Stabilizing. Okay, this is basically once you've identified the systems that are part of the problem, you need to focus on what you can do to correct them or stabilize them, get them under control, calm them down. Okay, and this is where taking a whole body approach is so critical. Okay. So if we're talking about autoimmune thyroid disease, it's not just a thyroid problem. It's a gut problem. It's an adrenal problem. It's a sex hormone problem. It's a neurotransmitter problem. It's a blood sugar problem. It's a neurological problem. It's a whole body problem. And the moment you start looking at your body as a whole system that requires a whole body approach, the sooner and faster you're going to get better. Once you've identified these triggers, correcting these triggers and stabilizing these triggers in the proper sequence is a big part of recovery. And this is where a lot of people don't get the direction and the guidance that they really need. Okay, so let's do a quick recap on antibodies and how they're influenced by these triggers. Okay, number one, if you haven't seen my video titled Thyroid Antibodies, Why TPO is Not Enough, then you're going to want to go back, you're going to watch that, but I'll give you a quick refresher in this video just to kind of bring you up to speed, okay? So in people who have Hashimoto's thyroiditis, it's what you're going to often see is you're going to see elevated levels of thyroid peroxidase antibodies or you'll see elevated levels of thyroglobulin antibodies. This indicates that the immune system is destroying the enzyme or the protein in your body needed to make thyroid hormone, and ultimately, if you do what traditional medicine offers, which is simply just take thyroid replacement hormone, what's going to happen is down the road, you're going to end up with a thyroid that slowly and surely just continues to burn out and shut down on you. And at some point in your life, it's going to be completely useless. Okay? In Graves' disease, the immune system now destroys the thyroid receptor, the TSH receptor. And so when it attacks that, what happens is that the thyroid hormones now can't bind to the receptor, and those thyroid hormone levels go up, 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 up. And so you have all these T3 and all these T4 levels in your bloodstream, which can be measured through T3 and T4. Now, most people with Graves and autoimmune thyroid disease, the typical management here is just literally either kill the thyroid with radioactive iodine or to remove the thyroid gland. And again, neither of these options, replacement of hormones or burning out the thyroid, addresses the immune system problem, okay? You still have an immune system. Just because you removed an organ doesn't mean you've removed the immune system. So what causes elevated thyroid antibodies? Well, first and foremost, autoimmunity involves a genetic mutation, okay? You have the genes, okay? These genes have been passed on to you from your mother or from your father or from both. And you can't change those genes. You can't change the mutation or what you've inherited from your parents. but you can affect the way that those genes are expressed. And this is where your energy and your focus needs to turn to. Autoimmune disorders are turned on by a combination of genetic, lifestyle, and environmental factors. And again, like I said earlier, this is where you can alter, this is what you can alter, and this is where you can have success and influence on the progression of your disease in the lifestyle and in the environmental areas. So instead of getting hung up on trying to figure out what's the best kind of thyroid medication to take, how much thyroid medication should I take, should I take compounded, should I take T4, should I take T3, redirect your energy and your efforts to the root causes behind why your TSH and why your antibody levels are elevated in the first place. Now, that doesn't mean you don't need thyroid medication, because most people with autoimmune disorders are going to need some degree, because you can't undo the damage that's been done to the thyroid gland, okay? Nevertheless, where medicine misses the boat almost 100% of the time is what I just described to you, okay? If you take a step back, okay, from this microscopic view of just looking at TSH, just looking at T4, and you start focusing on the big picture, these triggers, you're going to see how silly the debate about the medication you're taking really becomes. Thyroid levels go up, they go down in response to so many of the daily triggers and stressors in your life. Your blood work, when you have it done once every 6 months or once every 12 months that your doctor, your endocrinologist runs, it's a snapshot, it's a moment in time, if you will, of what's happening in your body. So try to keep this in perspective. Again, put the energy into identifying the triggers and correcting them in the right sequence. All right, so got a little long-winded there. Coming back to the title of this video, why are my thyroid antibody levels still high? It really comes down to a couple scenarios. Number one is the obvious. The autoimmune triggers have not been removed, okay? This probably is the most common reason why elevated thyroid antibodies remain high in the first place. This should make sense. The cause is still out there. Let's say you have a leaky gut, and I'm only using this as an example of one of the potential triggers, but let's say you have a leaky gut. If you do a Google search, leaky gut and autoimmune disease in PubMed or the National Institute of Health or the New England Journal of Medicine, that search will come back with plenty of articles to keep you busy with. You could do the same thing with environmental toxins and the thyroid, or inflammatory cytokines and the thyroid. But since most people are familiar with the term leaky gut, let's use this. A leaky gut can be a major trigger into the development of not only autoimmune thyroid disease, but also neuroautoimmunity. This is where the immune system begins to attack the neurological tissues of the brain, the spinal cord, the brain, neurotransmitters, nerve synapses, neurotransmitters, which are, again, those chemical messengers that your nerves use to communicate back and forth. And this is where you start seeing the connection between thyroid disease and things like MS, or thyroid disease and Parkinson's, or thyroid disease and depression, or thyroid disease and chronic migraines. The brain-leaky gut connection is only one of the powerful triggers for autoimmune disease. And it's my guess that your general practitioner, your endocrinologist, has not checked you for a leaky gut. They probably just gave you a prescription for antidepressants or anti-anxiety medications or some sleeping pills, okay? Google leaky gut, LPS bacteria, and depression. You'll be shocked, okay? How can Synthroid or any other thyroid medication, radioactive iodine, or antidepressants ever address this? And the answer is it can't. So again, medications don't address the immune system. If you're watching this and you've had your thyroid removed, you still have an autoimmune disease. Just because you remove the organ that your immune system has destroyed, it doesn't mean that your immune system is no longer a threat to the other tissues and glands of your body. So the big point here is that I want to stress to you is that when you have an autoimmune disease, again, it's a systemic problem. And I only use the brain-gut connection as one example, but there are many, many others that need to be identified as well. So again, this is an example of how a trigger could be priming your immune system and keeping your antibody levels elevated. Having multiple triggers, without a doubt, it's frustrating to both the doctor and the patient, because if you can't identify them, or if your doctor doesn't identify them, well then, obviously you can't correct them, and consequently, you're going to continue to feel lousy. It's like baking. If you miss one of the ingredients in your recipe, your food doesn't come out tasting right. So admittedly, this is the challenge, not only finding the primary triggers, but then correcting them in the proper sequence. And obviously, this varies from patient to patient to patient. Now, in one patient, give you an example, you may start out addressing the leaky gut, but in the next patient, you may need to start with lowering the toxic load. You may need to do things like glutathione recycling, glutathione nebulizer treatments. You may have to, in a particular individual, you may have to eliminate bacterial overgrowth or something that's keeping the immune system primed, like an active infection. In another individual, you may need to focus on detoxification. Another common trigger for those people with autoimmune Hashimoto's that can keep the antibody levels elevated comes down to inflammation and toxins. Okay, now I've done a video titled Inflammation, Your Thyroid's Worst Enemy. Okay, this is a two-part video series. Highly recommend that you go back and watch this. But here's the thing. There are many toxins that we're exposed to, and it's impossible to not only treat for all of them, but to understand how each individual reacts to the specific toxin. So two patients exposed to the same toxin can have two very different responses. And this is why in my practice, I rely very heavily on testing. Some holistic practitioners only look at your hormones, they only look at your adrenal glands, they only look at a leaky gut. These may not be the primary triggers. These may be triggers, they may be part of the root cause, but these may be secondary or tertiary problems, okay? So in other words, they could be contributing triggers, but they're just not the main one. So another reason why antibodies might remain elevated and not come down is if you think of an autoimmune disease like a pendulum, okay? This is a big pendulum that swings from one side to the next. Once it builds up enough momentum, it doesn't matter what you do, it just doesn't come to a complete stop, okay? Because you decided that you're going to eat better and you're going to follow an autoimmune diet protocol and you're going to take a couple supplements for a couple months, okay? I get thousands of emails every year from patients who are literally at their wit's end, okay? They say, I just don't understand, Dr. Hagmeyer. I've eliminated gluten, I've been doing everything I've read on the internet. I'm on an autoimmune paleo protocol. I'm working with a paleo dietitian, and I still feel lousy. Well, here's the thing. If your immune system has been chronically activated by certain chemical mediators, and one of them that comes to mind is something called NF-kappa B, you're not going to shut this down overnight, okay? It's going to take time. And this is why I stress to patients, the longer you wait at putting off the testing that you need, the longer you're going to go without answers, and the further down this path, the more momentum is going to be built up behind that pendulum. You're going to find yourself with chronic activation of those inflammatory cytokines. So in summary, in order to reverse autoimmunity, in order to stabilize autoimmunity, you need to take a multi-system and very methodical approach to healing. Time is of the essence. The longer you go on trying to figure out what's wrong on your own, the deeper these problems become and the more difficult and complex they become. I just had a patient last week who came to a seminar that I did in my office about a year and a half ago, and he said, you know what, Dr. Hagmeyer, that was the greatest seminar I ever went to. I went home and I started changing my diet and I started doing all these things, and I realized how complex this was. And I've come to the point where now I realize that I need someone who knows what they're doing to figure out what's wrong with me, okay? So again, the longer you wait, the worse it gets. So again, number one, identify your triggers. This is where you're going to need to work with a functional medicine practitioner, get the right kinds of tests, and get the right metabolic testing done. This is going to start the process of putting these pieces together, bringing these pieces closer together, and these tests are literally going to serve as your compass or your roadmap. Now is not the time to take a shortcut. Number two, remove the autoimmune triggers that you've identified with testing. And number three, correct them in the proper sequence. This is where the challenge lies. But this, again, will help calm down and drive down inflammation, eradicate infections, balance your stress hormones, lower the toxic load, support the neurotransmitter and brain health, or whatever is going on inside your body. Again, point to remember, each of us is different. We just have different biochemistries. Men, women, different sizes, different shapes, different colors. So again, you can't just follow some general information that you see out there on the internet or do what your next door neighbor is doing for their autoimmune disease, okay? Next, and this is very important, you need to be an active participant in your health. This is not simply about swallowing a bunch of pills and having a cheat day here and there. It's just not going to work, okay? You need to be focused, you need to be dialed in to where your problem is coming from, and you need to be consistent with the steps that you're taking, okay? That's so critical when you have an autoimmune disease. Number four, choose a doctor who's going to lead you down the right path. You're going to be working with a doctor for a minimum of 12 to 18 months. You're going to need to have a good relationship with them, a good connection, a good rapport. So many doctors today offer free phone consults. We do it in our office. It's something that before you choose a holistic doctor, definitely something that I would want to do is get on the phone with them, find out how their approach is, pick their brain a little bit, and find out if you're a good fit and you guys could work well together. Okay, this is, again, a great way to know who your doctor is, what he does, how he does it, and most importantly, if you connect with him, okay? So there you have it. These are just a couple of the reasons why antibody levels remain elevated, what you should look for in a holistic doctor. In my next video, I'm going to talk about something known as silent autoimmunity, okay? This occurs when there's an overwhelming number of symptoms going on. There's an awful lot of patients out there who have a lot of mysterious symptoms, yet the doctors tell them that tests just come back normal, okay? So we're going to be talking about silent autoimmunity in the next video. So for more information, visit my website, www.drhagmeyer.com. Tons of information there, additional videos that I would really encourage you to watch and just absorb and soak in all that information, okay? So till next time, take care.